My name is Dickson Oruko Nyawinda, the Minister in charge of Water, Sanitation, Environment, Forestry, Climate Change and Natural Resources, Homa Bay County. We in Homa Bay, we are proud. And on behalf of His Excellency the Governor, I want to say thank you. The partnership with the IDF started way back in 2019. It was a welcome relief for the people of Sekakagwe. The community around had been asking for water, and it was a headache even for the county government how we could give them an infrastructure that will enable them to access water, not only access water, but clean, sufficient drinking water. And so when IDF came on board, as the Minister in charge of water, I was extremely grateful because under our CIDP plans, we are targeted to produce a certain amount of water for the entire county. Now, the total amount of water we were expecting to produce for the entire county by the end of this year was 70,000 cubic meters. Of this, much of it we were expecting to give it to the rural area and part of it to the urban areas. Now, when IDF walked in, one of the best things that happened when we entered into this partnership was that the water produced will not need any other processing for it to be consumed. And we are grateful for Yamaha, for the technology that makes it possible for us to use Lake Victoria and to drink the water directly from the taps.
I'm called Doris Omer. Madam Doris Omer is the principal of St. John Seka Secondary. I'm happy that we have come this far, and I thank God that we are having the water project in school today that is nearly being complete. This process began quite early in 2019. We have known IDF as an NGO that has been supporting needy students with school fees. But later, as a community, as a school, we were faced with a lot of challenges based on water supply, because we've been relying directly on lake water, Lake Victoria, which is not very clean, and has been a challenge to our students, the staff of the school. We have had frequent cases of attacks from waterborne diseases. And so together with the community, we thought about approaching IDF if they can help us come up with some water program that can supply clean water to the school and to the community. And so we approached IDF in the same year, 2019, and we've had quite a number of meetings. We came up with community participation, which we held about 6 times. The IDF took it positively. They wrote a proposal to the donors.
I'm Frederick Oguta Auma. I'm the chairman of Sekakagwa Clean Water Project. We are happy and we are very grateful for the support we've received from the Japan Embassy. And as we speak today, the project is almost done. So the project brings together the locals and international participations and expected to enhance public basic health care, the relation of the sustainable social, economic and development. We applaud the Sustainable Development Goals and SDGs partners who are the sponsor of the project. And this is none other than Japan Embassy in Kenya with direct link with the NGO IDF.
And we thank God that in 2020 we got a positive response that the Japanese government through the embassy accepted to fund the project.
I'm Frederick Otieno Odiembo, Facility in Charge Nyagoro Health Center. I wish to commend the job done by IDF for Nyagoro, where they conducted a scorecard to check on issues which were raised by the community on service delivery to Nyagoro. Following the scorecard, there were areas that were identified as weak areas that needed improvement, and there are actions that has been taken, and currently the facility is experiencing a great improvement on some areas.
I'm Michael Omolo, Ward Administrator for Kochia Ward. The program Integrated Development Facility has been working in my ward, and through the activities in civic education in the ward, the community requested for an exercise to conduct a community scorecard, basically for Nyagoro Health Center, at least to have improvement in the hospital which has been affected by the coronavirus issue just before. So after the community scorecard, we have been able to record a number of improvements in the facility.
One of the areas that was identified was the issue of staffing. So far, Nyagoro has received one more farm tech that is employed by the partner, one more nurse employed by the county government, 2 more CEOs, one employed by the partner and one employed by the MOH. We've also received clerical officers, 4 of them from the county government of Homa Bay, and that one is a plus to the facility. Secondly, there was an issue of low workload, and this was occasioned by the COVID-19. Nyagoro was an isolation center during COVID-19, and most of our patients were transferred to other facilities. Following the scorecard, the community raised their issues, and currently the facility is back to its feet with the workload of last month workload we had 1,200, the general workload. Maternity, there was low uptake of maternal services, and maternity has improved from initially we had deliveries at around 3 per month. Currently we have 15 for the month ending May, and there are strategies we put in place, that including incentives for the mothers. So that was an improvement. There was also a drug supply that also came out, that Nyagoro did not have adequate supply of essential drugs. This was occasioned by KEMSA delay. Currently, we've received supply for KEMSA, the essential drugs, once, and we are pushing on well, despite it's still not adequate. But at least we have something to start with.
An improvement in the facility in terms of doing the fence, at least to ensure security of the hospital. And of course, we also managed to do with the little funds collected from the facility to improve the availability of water through roof catchment in the male ward.
My name is Willis Bolo. Currently, I work with the county government of Homa Bay as the head of budget and economic affairs. That means that I guide decisions, allocative decisions of the county government, and I work with the county government entities to arrive at the best possible decisions. Most of the time when we do this, we work closely with the non-state actors, mostly the ones from Homa Bay County CSOs network, where Uraia and other organizations are actively involved. So usually when I plan for budget, we normally invite them, and most of the time we share and we agree on the time frames. As a practice, most of the time between July and August, we concentrate mostly on generating the budget circular, where we guide people on how they are going to do the budgets. We provide the timelines, we give the indicative ceilings, and after that we normally embark on preparing the annual development plan. The annual development plan, it's very critical, and most people don't seem to appreciate that, because whatever is not found in the annual development plan, it's not easy for us to bring it into the budget, and so we always consider it a very critical process. We do this normally at the wards. We normally facilitate ward level consultations, where the citizens have an opportunity to share with us what they consider as their priorities, in terms of the one that comes number 1 is the one that we give priority, followed by the one that number 2, in that order. They need to sequence those priorities, because the money we have is never enough, so it's very, very important. Now, my observation is that sometimes they don't make the best decisions, so it's very, very important to do civic education. Even me, when I go there, I take some time, I explain to them the things that they need to really look at. For example, there's no need to start a new project when there's another project that needs to be completed first. So those are some of the things that we emphasize. Issues like equity. There's no point having all the projects in one area, maybe one location, at the expense of others. So we encourage them to be equitable. Equitable not only regional, but even among gender. If there's a project that favors men, they need to balance with the projects that favor women, and play with that benefit youth and other marginalized groups.
I'm Judith Rajwai, acting sub-county MOH of Rachuonyo East Sub-County. At the same time, I'm serving as in charge of Kabondo Sub-County Hospital, which is our sub-county hospital in Rachuonyo East Sub-County. I want to say we are most grateful for our partners, and particularly IDF in partnership with Uraia. Sometime in 2020, we did a scorecard, and using the scorecard just to assess how we are doing in service delivery, and a number of things came out when we used that. A number of things came out, and some of them in the survey, we realized that we had what the community said, we didn't have enough workers, and even the access road. Around that time, the road from Kadongo up to the hospital was under construction, and that hampered a lot of clients from accessing our place. And even when we had a client who needed to be referred, we had challenges despite the fact that we had a working ambulance. And also we didn't have theater. This sub-county being one of the new sub-counties that was carved out from the major Rachuonyo former district, we have not had theater, and that meant that the mothers within the community, if there was any complication that we would not handle at this point, then we were forced to see how the client would be transported from here, either to Homa Bay or to Oyugis, and that required the facility to use an ambulance, and with the roads, that would lead to delays, and we know what delays in around pregnancy and childbirth would either result to. So that's something that we really decided that we would have a working theatre, and it is good. Again, together with the IDF team and Uraia, we were working together, and today that is already being fixed, and we appreciate that. There is a theatre. It's, I would say, a higher percentage of the work has been done. The equipment is already purchased. We only need to have it finished, and we will have a medical officer posted here to come and do the operations right here, so that we'll not have to do a lot of referrals. And I believe that the community would really benefit a lot.